You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, a new procedure that is revolutionizing facial rejuvenation. The weekend facelift, or it's also called the quick lift, is sweeping the country. If you are unhappy with the way you are aging and you don't want an unnatural look, my advice is stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Thomas Kotoske. Dr. Kotoske is a board-certified facial plastic surgeon. We've invited him on the program today to discuss the weekend facelift. Dr. Kotoske, welcome to the program.
Thank you, Randy.
Now, before we get into today's topic, tell us a little bit about your practice. I guess you do everything. Is that right?
I do.
For the most part?
I have the Cosmetic Surgery Institute of Phoenix, which is a nationally accredited surgical facility that does all aspects of cosmetic surgery. We perform full facial rejuvenation and body enhancement procedures.
You call yourself a total body cosmetic surgery specialist?
Yes.
So a lot of body work as well? I mean, lipo,
Absolutely.
tummy tuck?
I am board certified in facial, plastic, and reconstructive surgery, as well as fellowship trained in total body cosmetic surgery. So at our facility, we have one of the highest volumes of breast augmentation in the Southwest. We perform a lot of liposuction procedures, body contouring procedures as well. We are especially attuned to facial rejuvenation techniques, and with that, we have developed a new procedure. It's called the quick lift. It's the weekend facelift.
You say it's revolutionizing the industry, the way surgeons are approaching the facelift. Elaborate on that.
Well, with years of training, you begin to see the nuances of certain facelifting techniques and what truly works and what gives a plasticized appearance versus a very natural look. This particular lift provides us with the elements from each of the procedures that we've been taught in the past, puts it together and gives a very natural appearing type of facelift.
Is it a gimmicky when I hear things like weekend lift or?
Not at all. This lift has the advantages that, due to the position of where the sutures are placed, that means the stitching that's used underneath the skin, and the way that we move the muscle tissue, the way we remove fat, we have a very minimal downtime and very minimal pain component with this procedure.
Okay, unnatural looks. Does this give a more natural look?
It gives, and absolutely gives a more natural look. And that's really what drew me to this particular type of a procedure.
Two terms, quick lift, weekend lift, same thing?
In this case, yes. And there are weekend facelifts that have been described in the marketplace, in the media, that don't offer all the advantages that the quick lift truly does.
So how is the quick lift different, as you see it, than the traditional facelift?
The quick lift is a procedure that addresses the mid-face. It addresses the neck in a fashion that provides a very, very natural appearance without the downtime of a traditional facelift.
Okay, what about incisions, things like that?
The incisions are hidden with this particular procedure. We make an incision in the hairline. It wraps around this structure called the tragus, around the earlobe. Skin is elevated. Deep retention stitches are placed under the skin to raise that muscle tissue into the appropriate position. If liposculpting needs to occur in this area to remove some of the fatty deposition or fat pads that have formed here over the years, we do that in conjunction with it. So we get a very natural, uplifted type of a look with the quick lift versus this pulled back appearance that you see with traditional facelifting.
Is that in the hands of the surgeon?
Absolutely. Absolutely.
Okay.
You can have people that go off and try to get trained in specific types of surgical procedures, but obviously not everybody has an artistic component with the way that procedure is performed.
Now, we've had you on the program before, but I'll ask you again. I mean, how much is art and how much is science? How much is how much is it that you have to have an eye for this to get a great look?
I think that we all need to be trained and go through the appropriate certification processes to do the work. But not everybody that goes to a great institution has the ability to perform the appropriate procedure or to see the patient, make the diagnosis, and then actually accomplish what needs to be accomplished.
Now, a lot of changes in the world of plastic surgery, facial plastic surgery, but with those changes, a lot of unnatural looks. We were in the green room, and we were watching a soap opera, and you were commenting about some of the stars that, lips too big, things like that. I mean, to you, what's this, is it symmetry you're looking for, something that looks natural? I mean, what are you trying to achieve when you want them to look rested, younger, what is it?
Excellent question. My attitude on facial plastic surgery is I would like someone to be able to have a procedure performed, look very refreshed, look like they've had the best sleep of their life, have someone look at them and not see the telltale signs of plastic surgery, the overblown lip, the overpulled eyes, the mouth that has now been changed due to the fact that our vector of pull is in a different direction.
Interesting.
I don't like that. I like it where you look so natural. There may be, you can take it as far as you want in terms of how much signs of aging we remove. But the fact is, to induce a very natural appearance is what we're all working for.
Okay, now you say that the good work goes unnoticed. That people don't know that you had something done.
It's very true. I mean, if you can take care of someone and you've reduced the signs of aging, they feel good about themselves, they go back out into public and someone says, my God, you look fantastic. What have you been doing?
Okay.
I've been working
Even
out.
their friends may not know.
Absolutely.
So the patients that are coming to see you now, are they getting younger and younger, older and older? And who is your typical patient that comes in for this?
A very good question. We see patients of all different ages, and it probably starts in the early 40s all the way through the 70s. This technique we modify to fit whatever patient it is that we're dealing with. And so basically, when you say the ideal patient, who is that? That's someone that has started to see the signs of aging, whether it's some facial laxity, some sagging, some loss of facial volume, fatty deposition, a change in the shape of their jawline, an increased pouch of skin underneath their neck. These are the individuals that are coming in to have a surgical procedure such as this.
And the younger patient, is this weekend procedure, as you call it, weekend lift, is it more for the younger patient though? Mid-40s?
I'll tell you what.
Early 40s?
It is used on younger patients. We have had people in the fashion industry, people in the news industry. It's utilized on all forms of patient aging. Elderly patients, as you'll see with some photos.
Do you do traditional facelifting though?
I do traditional facelifting.
Or most of it is this?
No, I've done it for the last 15 years of my life, but the fact is I have evolved in the last few years to see that the appropriate way to address it is via this approach.
This is getting you better results?
Much. I love it.
Is that right?
Absolutely.
Okay.
And the patients do too.
Okay, we're going to take a quick break. We come back, we're going to take a look at some of these photos. I've flipped through a few. Very, very good work, by the way.
Thank you.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. It's about the weekend facelift or quick lift. We're here with Dr. Kotoske, a board-certified facial plastic surgeon. We'll be right back.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light super activates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today is an extreme makeover edition. We're talking to the Phoenix's hottest facial plastic surgeon, Dr. Kotoske. I mean, you're a very busy guy.
Absolutely.
One of the reasons we brought you on the show. Now, these techniques we're talking about, and you have a lot of photos. This is the weekend facelift, the quick lift, and it's named that primarily because of the downtime.
Right.
Okay.
We have very minimal downtime. There are patients that are back to work within 3 to 5 days.
Is that right?
Absolutely. As far as facial swelling.
And the results are big. I mean, big enough?
They're equal to any facelift that is on the market today.
Right?
Absolutely. In terms of the duration of effect,
wow.
There's no difference.
So you've had some patients, 3 or 5 days, they're back to work.
Absolutely.
And everybody doesn't say, wow, what'd you do?
Well, I'll tell you, some are very dramatic. I mean, and the reality of it is they're always dramatic, but the fact is if you take a younger patient that has just a few fine lines that are present and different things that are starting to show, we can erase that and get them back very quickly because the procedure is more minimally invasive.
Okay, these techniques, is this the future, you think, of facial rejuvenation?
Absolutely. It is a culmination of procedures with minimal downtime, and everybody in this world today is looking to get something done, get enhanced, feel good about themselves, and get back to their lives, basically.
Okay, so you brought some photos.
Yes, I did. And the photos I brought show patients as we go from our 40s up into the 70s, and it really depicts how this procedure can evolve and be utilized for everybody in that patient population.
Okay.
So let's start off with this first one. We have a female that is in her early 50s that has some issue with her jawline where she starts to develop some fatty deposits through here, some laxity, some nasolabial folds through here. And through the quick lift procedure, we've gone ahead and made some incisions. We've gone ahead and raised that tissue in her midface to provide a very soft, natural look.
Yeah, very pretty. Very nice. I mean, a complete difference. I mean, this could be the younger sister.
Absolutely.
Of that same person.
You know, to further go on with that, if you look at the way that the jawline is defined, and that is truly one of the key things with facelifting procedures, we try to remove this fatty deposition on all patients so that we have got a nice flow here and move this cheek pad right up into its original position. On a patient this age, you are able to, you know, enhance.
She looks about 10 years younger.
Absolutely. And this procedure is noted for that. There's no question about it.
So you addressed her neck, the mid-face, you reposition the tissues?
Absolutely. What I've done is I've gone ahead and done some liposculpting along this jawline and underneath the chin. We've elevated the tissue. We've actually raised this muscle tissue up along with the mid-face.
So the muscles are touched?
Absolutely.
Okay.
That's the key to the procedure. If you do nothing more than just move the skin, you've lost, because within a year that patient's back and they don't have a long lasting.
Is it fat, skin, and muscles?
Absolutely. If you notice the squared appearance of this woman's face, typically, I see this all the time. Women in their 40s, as they progress on, they will go from a nice oval appearance to a very squared appearance due to the fat deposition through here. Sculpting this fat with a very small microcannula and then elevating the tissue with the quick lift provides a complete enhancement. It's fantastic.
Okay, and these weren't touched up?
Absolutely
obviously.
not, no.
Hopefully not. And because anybody looking at this, when we put these side by side, this is a great job. Great
Absolutely.
work.
Randy, here's another one, and I absolutely love this case because here is basically the type of female that I have walk in my office of this particular age group. Slightly hollowed out, lost volume in the cheeks, very squared appearance in the jaw. This patient had such a sallow appearance to her.
What do you mean
face.
sallow?
Sallow means a hollowed appearance. Almost a saddened appearance, and it's where, you know, the active aging has really gotten a hold of you. You've lost some fatty tissue in the face. It started to droop. It's forming along the jawline and so forth. Underneath the eyes, you see a loss of tissue as well.
When you see this, by the way, on a consult, do you say, wow, this would be great for this lift?
Absolutely.
Really?
I look at a patient and I know within minutes of what I can accomplish. And I usually take them through the process. Not usually, I always take them through the process where I will go ahead and do a physical exam on them. I'll lift their tissue and say, this is what I can accomplish with you.
Is that right?
Absolutely. And as we go through the process, we show them just how much we can do, and if we need to do their eyes or do other parts of their face in conjunction with it, if they need a rhinoplasty to thin their nose out to improve their look, we touch on all of that.
So for this woman, what did you do?
Basically, this is just the quick lift with liposuction or liposculpture of her mandible. And if you look at the post-operative picture, it's dramatic. She is so soft, she is so beautiful. And when she came into our office just bouncing in, she was on cloud nine. And
it is a different look. Completely.
Absolutely.
Without sounding shallow, I mean, that, you know, people can't help but judge people today by their appearance, things like that. But she goes from an attractive woman to like a bombshell. She's a beautiful, beautiful woman.
But is she plasticized?
No.
Does she have the overblown lips?
Just like a young, healthy, vibrant.
One of the things I should point out to you is on all of these lifts, if you look at the mouth, the structure of the mouth, it doesn't change. We don't get a pull out this way. And that's very typical of these types of lift because the flow is upward. It's not backward. So that's one of the reasons that I like it so much. Here's another photo of her, and it just shows the nice flow and the pre and post-operative changes.
That's a 10-year look.
Absolutely, absolutely.
Weekend lift, interesting.
You know, here's another patient, Randy, that we have that just shows such a nice, soft change. And she's in her 50s. She's moving on now in age. But we've been able to take care of the heaviness in her eyes. We did do a blepharoplasty with skin removal of the eyelid. We did do a little chemical peel of her lower lid, but we did the quick lift with liposculpting of her jawline, and we gave her something that's just so soft. Her appearance is soft. She looks like she did many years ago. It is very nice. And she now...
It's a fresh look.
Randy, I'd like you to look at the before and the after of the neck on this woman. I mean, we have changed the contour completely. This fatty deposition, the extra skin laxity, gone. The way her eyelids sit, the heaviness of her eyes, we've taken care of that with what we call a blepharoplasty with skin removal. And
it's a very pretty look.
The whole flow of her face is up. Nice jawline. It has softened her appearance tremendously. So a total success. She is very thrilled with that.
Do people seem to do this with changes in their lives, occasions? What are some of the motivations? I mean, when do people like this say, okay, I got to do something about it? What do they tell you?
That's a very, very good question. Oftentimes it's life-altering changes. A husband that's died, a divorce, or someone who's gone through a weight loss program that decides, I really want to do something for myself now. And they're going through a process where they're morphing maybe into a different person, or they're taking care of some of the things for themselves. They've given it to their family all these years, and now they want to take care of themselves. We see that quite frequently.
You say people don't want that done look.
Yes.
This does not look like that. Absolutely not.
That's what I say. It's a very natural look with an upward flow, minimal downtime, minimal swelling, minimal pain.
But I think the challenge is, people will ask me questions about this, but that how do you know? I mean, what do you look for in a doctor that's going to be doing this? Because they're all not doing it the same way. So what do you do?
Well, I think there's several things to look at. Number one, you want to make sure that they have the appropriate training. We've talked about head and neck plastic, facial plastic surgeons, and the appropriate training to perform this. And I think board certification is key to the process. You don't want to go to someone that's done just a handful.
So you're biased. You obviously believe they should be board certified plastic or facial plastic.
Yes, I do. And I just have to tell you that I think that those that have had a concentrated education in the head and neck and the facial region oftentimes are just very quality surgeons in this particular area. So I would look for that, a facial plastic surgeon or a general plastic surgeon. The other key is you want to go to someone that has a vast volume of procedures that have been performed.
Look at their work.
Look at their work. Look at pre's and post-ops. Ask the questions, what will I look like? What can I anticipate? They better have good consent forms. They better have good education for you on these procedures. They should have an accredited surgical facility that they operate out of.
You have?
Absolutely.
Okay.
You should have the ability to perform any procedure in your facility that you can perform at the hospital and have hospital privileges to perform everything that you do. That's the key.
I'm trying to not endorse the doctors that come on the program.
Absolutely.
But our program airs nationwide. I've interviewed other doctors. These are probably some of the best photos I've ever seen. So I'm glad to have you on the show because it's good work.
Thank you.
But when people always ask me, Randy, what should I look for? I always say, look at the photos. Because to me, certain guys have great photos and certain people don't. Would you agree with that? I mean,
I would totally agree with you on that. My thought process on it is this. It's an art. It is truly an art. It is not just being a mechanic.
You think you're an artist?
There's no question about it. You have to be able to see the patient and take them through the process.
Now we have to say results aren't typical with this lift, but are they typical for the most part, or predictable, I should say?
Absolutely. I mean, you never go into an operation unless you feel that you can achieve what you show them preoperatively, or what you've educated them with. If they've looked at all of your photos, or they can't look at all of them, there's thousands of photos to look at, but the fact is, if they've had an opportunity to review that information, you better be able to hit what they're looking for.
Do you think, because look, I'm more confused than ever. I talk to some people that all they're doing is fillers, and they're saying, hey, you don't need these lifts, you just need fillers. What is your response to that?
I think that's a fallacy. I think that with skin...
But you're a surgeon, of course you're going to think people...
No, you know what, I do a lot of fillers, and I have patients that come to me specifically for fillers. And I use Sculptra, and I use Juvederm Ultra, and I use Restylane, I use all the filler products. But the fact is, when you have excess skin elasticity that is hanging a pocket of skin, you can put filler in all day long. There's a huge anatomical fold or deficit. You need to basically pull that out first before you put the filler in. It's like filling a canyon up, but the reality of it is you've really not treated the problem. You really need to get to the root of the problem and then place the filler product.
Okay, we are out of time, but we have time for a few more photos. Let's take a look.
Let me tell you, I'm going to take you through.
And these are all weekend lift?
Absolutely.
Quick lift, you call it?
Yes, I do. I want to show you one gal. These are shot 2 days after her procedure. You ask me, what's the downtime, what to expect with pain and so forth. The reality of it is, if you notice her preoperative photo, she has the typical signs of aging. This is an older patient moving towards the 60-year-old age group with extra skin in her lower neck region, sallow or hollow cheeks, underneath the eyes, nasolabial folds. These folds are developing. We have performed her procedure. Look at her post-op and how dramatic. This is a beautiful woman.
That is dramatic.
And this woman
looks like her daughter.
Absolutely.
I think anybody would agree with that.
This woman had lost her husband, kind of had some sadness in her life for a long period of time, and decided she wanted to do something for herself. This is what we were able to accomplish with that. And I want to show you.
And go ahead.
I just want to show you a few more of her, because to me it's such a dramatic change, and it's not a plasticized change.
Is that the way she used to look? Because if I saw her walking down the street, I wouldn't say, boy, and I pride myself. We talked jokingly, and I said,
Sure.
I could spot a great facelift down the street.
Right.
And you said, I challenge you if I could see yours, but that's good. I guess it doesn't look pulled.
It doesn't look pulled. It doesn't look fake. It took away all the signs of aging. Plus, it gave her a look that.
But she looks different.
She looks pretty.
But
she
is that
looks like
the way she used to look? Like if she looked.
Absolutely. If you look at old photos of her and so forth. But that is many years ago. If you go back 15 years, you'd see this type of a face. And it's not the over-plasticized.
That is dramatic. That's 15 years. Almost 20 years.
But here's the key. You ask, what can this lift do? Look at her neck. Look at the preoperative element of her neck and how much extra skin tissue there is and how much fatty tissue there is. This woman was shown on a CBS affiliate in Phoenix 2 days after her procedure. These are the photos that were taken at that time. So,
I mean,
that
very
is that.
pretty, very
it's 2 days
attractive.
out. Let me show you one other facial procedure here on an older woman. We're in our 70s now.
Okay.
We're talking about a patient in her 70s. Here's her preoperative look with all of her excess skin tissue, her sallowness, her hollowness, the hollowness underneath her eyes. Look at how soft and pretty she looks postoperatively. Yes. Not overrated, just took the signs of aging away to soften her appearance.
And the downtime is
minimal. Here's a 70-year-old female that is back and up and about in a week grocery shopping. So, you know, you have to look at that and say, how much are we taking away from their lives? Look at this 3/4 shot.
Nice neck.
Beautiful. And so can you accomplish this?
So that's not a full facelift?
It's not a full facelift. This is a minimally invasive lift where we do our anchoring and we anchor the mid-face up.
And it will last
as long
as you age. I mean, it's just going to fall like the rest of your face.
Absolutely. It will last as long as any facelift that's available today. This is not a skin-only type of lift. We address the neck with this. And
so you're looking at muscles, the fat.
Absolutely. Okay, another photo. Preoperatively, this woman was, she's in her 60s and so forth. She is a very active, athletic female. So her body is in different shape than her face, and she's lost a lot of fatty tissue in her cheekbones and so forth. Her eyes are very asymmetric, meaning they're different shapes. We did a lot to her. We went ahead, she came in from Boston. We went ahead and did the lift. We went ahead and did facial fillers to her cheekbones.
Incredible.
We had corrected her eyelid problem, her neck and so forth. This woman looks like a different human being in the fact that we've corrected the things that were her deficit. She doesn't look plasticized or overdone. See, she looks soft.
I'm noticing in all of these photos, they don't just look younger. I mean, this one is about 20 years younger.
Right.
And I think anybody looking would agree, but they look prettier.
Absolutely.
It's a pretty look. It's very, very nice.
It's soft, is what it is. So we've used.
You call it soft, okay.
It is. We've used facial fillers. We've used Botox. We've gone ahead and done her eyes in conjunction with the lift and some liposculpture of her jawbone. So that's a.
Do you see their personalities change?
Absolutely. It's like they flower. They really do. They're a lot of the sadness or internal angst or whatever it is that people have to deal with on a daily basis. I think that they do much better if they look at themselves when they wake up.
So when you see them on the follow-ups, they act a little differently?
Completely.
Do they tell you they're more social, they date more, or whatever?
Absolutely. We see that all the time. It's a nice adjunct.
You like this. You like this part.
I love what I do. I feel like we're able to make some just very positive changes for people, and I really enjoy doing it. Randy, I just have a few more pictures I'd like to show you. This particular female came in. We only had a short period of time. She was vacationing in Phoenix, had 2 weeks with her daughter, came in from out of state. And we realized to go through a full facelift, it really wasn't required, but what we needed to do was enhance her chin, basically use some fatty tissue for filler, and do a full face fat transfer. And we were able to accomplish what looks like a facelift in a very short period of time with just fat transfer and chin implant.
Very nice.
Some liposuction of this jawline just to kind of correct a few of the fat depositions through here. Very big change. The other thing is we will go ahead and we'll fill lips and give good lip contour.
That's a good example.
With our procedures, because I'm a believer that you should have good
lips overdone.
Way overdone.
At least in my opinion.
Way overdone. I don't like that artificial, blown out, look like a fish type look. I like.
But some people must like that. Because you see it everywhere.
I think they think that is the look you're supposed to have because that's commonly done by a lot of ancillary people who inject lips.
Do you have guys, colleagues, other surgeons that love that look?
I see it produced by other surgeons all the time.
You think they like it?
They must. They're
Is it
doing
patient-driven or surgeons driving that? I often wonder that.
You know, I think it's media-driven. You look in the media, you see many people that are many movie stars that are out in the public with these overblown.
So you
lips.
don't do it?
I'm not a believer.
If somebody says, Dr. Kotoske.
No. What I like to do is I like to have a beautifully contoured lip with a good Cupid's bow. That's the structure. Just a nice shape and form with a little bit of flip and give it a sexy look.
So if you want an unnatural look, you're the wrong guy to go to.
Exactly.
Okay, all right. Very interesting. I want to thank you for coming on the show.
Oh, you bet.
Some final tips, by the way. Yeah,
okay.
I mean, women, I guess there's perceptions out there with aging men, aging women about what needs to be done. Where does somebody begin? They're starting to not like the way they look.
Where does somebody begin? They need to be educated. They need to educate themselves. So the first thing you would do is you need to do some research. You need to get on the internet and start looking at the procedures that you're interested in. You need to start looking for a physician. You do that by getting online and looking for physicians in your area or wherever it is that you'd like to have your procedure. You then go to the board and you actually investigate that physician to determine.
Is that right?
Absolutely. I think it's quite important to look at their records, know what type of work they've been doing, how long they've been doing it. Find out if they're department heads, if they carry any type of educational background where they are professors of plastic.
You were a professor?
Absolutely, of plastic and reconstructive surgery as well as head and neck. I'm also a national lecturer, which I think is important for people to realize that you need to go to people that are involved, that are interested in learning and furthering their education. So I think being a national lecturer, I think being an individual that's training other physicians to do procedures is a good way to validate.
How important is rapport, liking your surgeon?
I think it's huge. I think it is huge. I think that you really need to develop a bond with that individual and trust them that they're going to do the right thing for you. But that only comes from all the preamble. I
talked to one of your staff. They said, oh, they love Dr. Kotoske. It's like a trick question. I say, so do the patients like him? And I always see if there's a hesitation, but without hesitation, they love Dr. Kotoske. It's nice.
Well, it is nice. And I think it's important to have satisfied patients because that's the only way that you build your practice in this environment today.
Okay, great. Well, I want to thank you for coming to the show.
You bet.
Very interesting. Always a pleasure.
Thank you.
Been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this again online or direct a friend to watch it, you can visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.